many of us, when we think of physical activity, we often picture going out for a bike ride, heading to soccer practice, joining a Pilates class, or spending the day in the garden. We're often told to do it because it's good for stress management and overall health. But what we often don't consider are the marginalizing circumstances, such as racism, living in poverty, experiences of domestic and structural violence, histories of trauma, or substance use stigma, which can create barriers to people accessing and participating in physical activity. The reality is that accessibility to physical activity is significantly impacted by the social, economic, emotional, and physical environments in which we live. When these factors aren't addressed, it can seriously impact participation. Recognizing and acknowledging these barriers is the first step to promoting equitable access to physical activity. That means addressing obstacles individuals face due to gender discrimination, heterosexism, racism, socioeconomic disadvantage and poverty stigma, and barriers to education. Trauma and Violence-Informed Physical Activity, or TViPA, is one approach to reducing these barriers and improving access to physical activity resources. TViPA is a powerful practice that recognizes the beneficial effects of physical activity for the psychological health, physical health, and overall well-being of people living in marginalizing circumstances. TViPA establishes supportive environments where participants can build positive relationships with physical and social engagement. TViPA also brings awareness to the widespread effects of marginalization, trauma, and violence, with roughly 70% of adults experiencing at least one traumatic event in their lifetime, such as intimate partner violence, adverse childhood events, emotional abuse, and sexual abuse. So, how can we reimagine physical activity environments through a trauma and violence-informed lens to create safe, non-violent environments in which individuals can feel empowered to make choices, collaborate, and learn? Ensure all staff are aware of the widespread impact of trauma and how it can affect the emotions and behaviors of people or groups. Have community members co-create and co-lead programming. Offer free or affordable programming. Make plans for sustainable and consistent programs. Provide activity variations to support all levels of abilities. Use non-controlling language, offering options such as, if you're comfortable. Use invitational language and encourage people to make individual choices and to listen to their bodies. Use diverse images in physical spaces and advertising. Be flexible with timing, allowing individuals to join programming at any point. Offer self-identified women-only classes. Offer childcare. Offer snacks and food support. Offer gender-neutral bathrooms. Celebrate people for making the effort to show up. When possible, ensure participants have the gear required to take part, such as running shoes, sports bras, water bottles. By starting to break down the barriers to participating in physical activity, we can begin to rethink the best ways to address obstacles and create equitable opportunities for all individuals to achieve positive health outcomes and lead healthy lives.